questions should you ask when choosing a physician and an IVF center? When you're getting started in this process, it's probably a good idea to talk to a few clinics and doctors to get an idea about how they're the same and how they may be different and what may be the best fit for you. I would recommend scheduling a consultation with the physician and having a conversation about what your goals are. Of course, part of it is gut feeling about how you feel like you communicate, if your personality style sort of meshes with them. But from a technical perspective, I definitely would encourage you to find a doctor who's double board certified in both obstetrics and gynecology and reproductive endocrinology. And this is something that should be available. You can certainly ask the doctor or be available on their website. You definitely want to go to a clinic with, you can ask questions about how many cycles of IVF a clinic does per year, how many gestational carrier cycles do they do a year, how many egg donor cycles do they do a year. This should be in the hundreds, not tens. So you want to go to a clinic that has a lot of experience. You want to ask, do they have a dedicated team of a nursing team or staff that takes care of patients who are using egg donors? Do they have a dedicated team of patients who are using a gestational carrier? And you want to make sure that this is a clinic that is experienced and committed to patients going through with egg donors and gestational carriers. You also want to ask about the laboratory. And I think some of the big questions about a laboratory that you can ask are, what percentage of your cases do you do single embryo transfers? If you can put one embryo into someone and they have a high chance of success, then that is a good clinic. That means the laboratory is doing a great job. Whether you choose to put in one or two is, of course, a personal decision. But if a clinic is doing mainly single embryo transfers and they have excellent chances of success, then that is a good marker. You also want to see sort of what technology that they have in the laboratory. Now, it's going to be different for every clinic, but you definitely want to see sort of, do they have, how big is their embryology team? And how many cycles are they doing? And how many cases are they doing of pre-implantation genetic testing? The more experience an embryologist has, the better. And as a physician, I can put together a fantastic protocol. I can remove eggs. I can do an amazing embryo transfer. But at the end of the day, if I don't have a laboratory that can help get beautiful embryos, a baby is not going to happen. So I think those are the main questions that you really want to be asking the doctor and the clinic. How do you communicate? Is it through portal? Is it phone calls? What kind of access do you have to the doctor? Is it only through the nurse? Do you have access to their email? These kind of questions will help give you a feel of if this doctor and clinic are a good fit for you. Best wishes.